Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us today is Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. As always, Dr. Hinshaw will provide a brief update and then we will open the floor to questions.
Thank you, Tom, and good afternoon. First, I want to report that we learned this morning of an inmate at the Calgary Remand Centre who has tested positive for COVID-19. This is in someone newly admitted who was exposed before they arrived. I want to share this information today, both because it is the first case we have had in the province in a correctional facility, and also because it is a story of how all precautions were taken. The individual was admitted directly to the quarantine unit in the facility upon arrival. He did not report any symptoms on arrival and was quarantined with one cellmate who was admitted at the same time and who also had no symptoms. The individual reported feeling unwell the following evening, at which time both he and his cellmate were placed in isolation, and the symptomatic individual was swabbed. All inmates are assessed for exposure and symptoms upon admission to the facility or transfer from another location, as well as at minimum once per day while in the centre. Any inmate who develops symptoms is moved to isolation. Both of these inmates that I mentioned are now in isolation, and the facility has proactively implemented outbreak processes as a precaution. Generally, and where possible, correctional centres are quarantining new admissions for 14 days upon entry. This added measure allows for increased monitoring of new admissions for the development of symptoms before moving them on to other living units. Corrections has been working with AHS to ensure appropriate infection prevention protocols are in place at correctional facilities. In this case, this work helped officials identify this infection early. And when correctional staff reviewed video footage, it reinforced that appropriate health and safety protocols were followed. Alberta Health Services will continue to work with the facility to ensure all appropriate steps are taken to prevent the spread of the infection, and that these practices continue with the safety of staff and inmates as a priority. As we prepare for Alberta's relaunch strategy, I am shifting how I present the daily case information to you. This is intended to help Albertans have the best understanding of the measures we are watching as we consider the timing of Stage 1 of relaunch. One key measure is our hospitalization and intensive care admissions related to COVID-19. We are seeing a decline in these numbers in Alberta. Currently, 80 people are hospitalized, with 17 of those admitted to ICUs. It is encouraging to see these numbers coming down from last week, because it means fewer people are experiencing severe outcomes from this virus. It also means our healthcare system has the capacity to handle potential additional COVID-19 cases if needed. In total, there are now 4,020 people who have recovered from COVID-19, leaving 1,963 active cases in Alberta. In the last 24 hours, out of 3,232 new test results, there were 81 new cases. I'm sad to report one additional death has occurred. A woman in her 80s in a continuing care facility in the Calgary zone. This brings the total number of deaths in Alberta to 115. I struggle every day when reporting this number to not have it blend in as just another statistic. It may sound mundane at this point, as I have said it so many times, but every day I think of the friends and families of those individuals who have died and all those affected by the recent loss of a loved one from any cause. We are forced to grieve differently in this time of pandemic, physically distant from extended family and friends, and I offer my sympathy to all those who are navigating that difficult terrain right now. As of today, there are 678 cases in outbreaks in continuing care facilities across the province. At the Cargill facility, there are now 95 active cases in workers and 849 workers who have recovered. There are also 96 active cases among workers at the JBS plant in Brooks. At this facility, 497 have now recovered. And at Harmony Beef, there are 21 active cases in workers, and 16 individuals have recovered. Public health officials continue to work closely with the operators to respond to each outbreak, contain the spread, and ensure all public health measures are enforced and being taken seriously. The seriousness of these outbreaks is an important reminder that we must remain vigilant as we move towards Stage 1 of Alberta's relaunch strategy. The next stages of our relaunch plan will depend on our collective ability to keep infection rates low as we begin to relax public health measures. I continue to remind Albertans of the importance of responsible action. One setting where we can already be more active is outdoors. Spending time outside and enjoying outdoor activities is a great thing to do, both for mental and physical health. But we need to do so while being mindful of each other's health and safety, and while maintaining distances of 2 meters between ourselves and anyone from outside our household. I have received many questions and requests to clarify what activities are allowed under existing orders. Outdoor activities, such as the following, are permissible with restrictions. Golf courses and driving ranges were able to open on May 2nd with safety measures to ensure adequate physical distancing and increased sanitization and limited contact with high-touch objects and surfaces. Earlier this week, outdoor gun ranges were also allowed to open with similar precautions. Operators and Albertans can visit our webpage for more information, including specific directions and recommendations to responsibly participate in these activities. The Alberta Relaunch Strategy identified that on May 14th, online provincial campground reservation systems will open for bookings at select campgrounds, with camping in those locations starting June 1st. There will be restrictions in place to ensure safety. Private and municipal campgrounds will be able to operate in Stage 1 of relaunch as early as May 14th, as long as they follow appropriate guidance. This is intended to limit risk for employees and campers. For campers wishing to enjoy the outdoors this May-long weekend, please remember that physical distancing and restrictions on groups of 15 or more still apply. I have heard from many Albertans hoping to travel to summer homes, cabins, and cottages within Alberta. Responsible travel to these locations within the province is permissible, with consideration to local community guidelines. Travel to summer homes outside the province is still not recommended. I encourage any person who is considering traveling within the province to respect the health and safety of small communities and plan their trip with minimal stops where possible. Pack your own food and stop only for gas if necessary. As always, take all the necessary precautions to protect your health and the health of those around you. Communities that include private recreational facilities like lakes, sports courts, or trails may also be wondering when they can safely resume operations for their members and visitors. Operators of these private facilities may choose to do so, but must follow the guidance available on our website. Guidance that is general and labeled workplace guidance can also be used in these settings to make sure that enhanced cleaning and sanitization, distancing measures, and other measures that are needed to prevent transmission are in place. Private pools and gyms must remain closed due to the high risk inherent in these activities. And in lake settings, I discourage the use of communal features like inflatables or trampolines that could increase the risk of transmission of these viruses. If you plan on going anywhere, please consider voluntarily downloading the AB Trace Together app and having it open on your phone when in public. I cannot overstate how important contact tracing will become as we open up our economy and people begin moving around more. Contact tracers will need the help of the app to track new cases in the coming weeks and months. If we cannot rely on that information, contact tracing will take longer, the virus may spread further, and we may have to consider pulling back on our relaunch steps and putting restrictions back in place if the virus spreads at a high rate. Finally, this summer, I wanted to let people know that water testing at Alberta beaches will be delayed. This is a result of public health staff and testing laboratories prioritizing monitoring and testing for COVID-19. As lab capacity increases and lab staff return to work as part of our province's relaunch plan, we will reassess our water sampling program to see if some testing can resume later this summer. In the meantime, Albertans should use lakes and beaches at their own risk and take precautions if they choose to enter water bodies. This includes checking for visible signs of blue-green algae blooms and following advice that may be posted at beach sites. I know there will be bumps in the weeks to come for businesses, and I know many of these directions may feel confusing. Albertans have many questions about specific activities that they enjoy, and I will continue to offer as much guidance as I can as we work through relaunch together. I have seen comments from Albertans who are worried about going back to work and returning to some activities, and I want to remind everyone to be kind to each other. Albertans have pulled together to support one another through this pandemic, and that support remains as essential as ever. Public health officials are continuing to work on advice to determine what activities can safely resume and what additional measures will need to be in place. I ask Albertans to be patient while this work continues. More information and details will be shared in the days ahead through the Alberta Relaunch section of the alberta.ca website. Please be mindful of the risks associated with the activities you choose to pursue as we move towards relaunch, and stay safe. Before I conclude, I would like to wish all Alberta mothers and those involved in mothering a very happy Mother's Day this weekend. I know this year will feel a little different, but I hope you can find time and ability to connect with your loved ones, even if it is in a different way. This holiday can be difficult for some Albertans who have lost a mother, or for mothers who have lost a child. These feelings may be even more overwhelming during this time of isolation. Continue to check in with your loved ones about how you can support them. And for those planning to celebrate the occasion by visiting a family member in a continuing care facility, please remember the rules around masks, physical distancing, and the need to call ahead to make sure that there's an ability to visit safely so we can keep everyone safe. Thank you, and I'm happy to take questions.
All right, we'll now go to the phone. In addition to Dr. Hinshaw, we also have Dr. Mark Jaffe, Vice President and Medical Director with AHS, and Joanne Panasiuk, Executive Director with Alberta Justice and Solicitor General, available for questions. Operator, could you put the first question through, please?
First is Julia Wong with Global News. Go ahead, Julia.
Hi, this question is for Dr. Hinshaw. There have been 30-day limits on prescription drugs since March to stabilize drug supplies. As we move towards relaunch, will that 30-day limit be lifted, and what would be the threshold for that to happen?
So that measure was taken to make sure, as you say, that we did have adequate supplies of medication. And so I think the measure that will be looked at, and I will say that that work is being done in the pharmacies division of the ministry, so it's not work that I'm directly connected with. But what I understand about it is that the measures they're looking at is essentially the availability of medications, including the manufacturing and the shipping. And so those are the kinds of metrics that will inform them when they can start to ease off on those restrictions, but I don't have any information on timing. So we can maybe take that away and get back to you on that.
Operator, could you put through the next question, please?
Next is Michael King with Global TV. Go ahead, Michael.
Hi there, Dr. Hinshaw. What do you say about the request for smaller boutique fitness studios that will be included in Phase 2 of the reopen, because they're different than larger gyms and rec facilities, and we've seen a petition now with 7,000 signings asking for them to be bumped up in the reopen process?
So I know that physical activity is a critical part of people's health, and having the opportunity to be active, whether that's in a gym or outdoors or in people's own homes, depending on the type of activity, is incredibly important. One of the things that we need to consider as we're looking at the stages of relaunch, part of it is the risk profile of each individual sector or business. But part of it is the cumulative effect of many openings of different sectors all at the same time. And so we have to take both of those things into account as we're considering how we plan forward. Having said that, certainly if there are businesses or sectors that are looking through the workplace guidance documents and that are feeling like they can take measures to comply with all of the measures that are written out there, then I would really encourage those businesses to do so, to create those written guidelines. But really, again, we can't guarantee that there will be any chance to shift between stages because we have to take so many different things into account. But again, the way forward on that would be for those businesses that are interested to make sure that they're thinking through how they would make sure to keep their patrons and their staff safe. But again, no guarantees can be made.
Operator, could you put through the next question, please?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. We've been hearing more from professional sports leagues like the NHL recently in regards to coming back potentially to Alberta. They've been musing that a return would require daily tests for symptomatic and non-symptomatic players, coaches, staff, etc. Is that sort of resource available for them if they request it? And are you concerned that could create a two-tiered medical system in our province with that sort of service not available for, let's say, asymptomatic grocery store workers, for example?
So with respect to that question of the NHL, certainly we have been asked about that before. And the answer continues to be that, again, we've heard the speculation and the questions, but no proposal has been put forward in any detail, and I'm not aware of any kind of final decision. So it would be hard to speculate on what the conditions would be. In particular, that question about testing, again, that would be speculation because there's not been that kind of detailed proposal put forward that I've seen.
Operator, could you put through the next question, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. Daycares are slated to open in stage one, potentially as early as May 14th. What would your advice be to parents who are trying to decide whether it's safe to send their kids back to daycare? And can you explain the risks of a daycare setting, comparing with schools perhaps, and explain why schools and daycares might be on different timelines?
Sure. So I think with respect to the risks of having children go back into daycare, we're working with Children's Services on guidance for daycares and out-of-school care programs, and we're working to make sure that guidance does take into account measures that can make the children and the staff in those programs as safe as possible. Having said that, we also know that the number of people that any one person comes in close contact with in any given day, the more people that one is in contact with, the more incremental risk there is of potential exposure. So the reason that we're reopening daycares is that we do have some experience with having the essential service worker daycares that have been open and being able to see how the restrictions that were put in place for those daycares have worked. We have not seen issues with those particular daycares, so we're looking at using some of those similar restrictions as we open other daycares across the province. And measures like making sure that the number of children and staff in any one room is kept to a low number. That is going to give us the ability to limit the number of people that children, again, come into closer contact with. And in school settings, that's a bit more difficult, depending on class sizes and the abilities of teachers to navigate. Whereas with daycares, again, we recognize that the early openings won't have as many spaces as perhaps people may want because we are keeping those room sizes lower, but that's the way that we're limiting risk as well as by limiting certain activities that may enhance spread. And also there will be very strict requirements for parents to assess any symptoms that a child may have, and any child who is sick will not be able to attend daycare.
Operator, could you put through the next question, please?
Next is Matt Woodman with CTV. Go ahead, Matt.
Yeah, hi there, Dr. Hinshaw. Some sports leagues in Alberta are still waiting to see if they'll be able to have some sort of summer season for the kids. What's the directive for these organizations?
Yeah, I absolutely hear that. I know we get that question a lot. And at the moment, the activities are limited to those that can take place within the distancing measures. So activities where you have 15 people or fewer in a group, where if it's children participating in the activity, where children can be kept 2 meters apart from each other. If they're doing something like kicking a ball back and forth, then that would be totally fine. But if they're sharing equipment, so throwing a ball or a frisbee or something that touches many people's hands, that would not be something that would follow the rules right now. And so that question of when will a decision be made about other sports and whether there's any kind of precautions that sports that may have, for example, baseball, where people handle a bat and handle the ball, is that something that can take place this summer? Or even soccer, certainly kicking a ball back and forth is fine, but playing a game of soccer is difficult with if we say the children have to stay 2 meters apart. So those are all things that are still under discussion and decisions haven't yet been made.
All right, we have time for 2 more questions. Operator, could you put through the next one, please?
This is Jennifer Lee with CBC. Go ahead, Jennifer.
Hi, thanks for taking my call. Dr. Hinshaw, can you provide some information about an outbreak at Canada Post? How many people are we talking about who tested positive? What's being done in terms of going in there, helping protect workers? What's being done to address the outbreak inside that?
I'm sorry, you're cutting out a fair amount. Can you repeat the question, please?
Sure, sorry about that. Can you hear me better now?
Yes, thank you.
Okay. I'm asking about an outbreak at the Canada Post plant here in Calgary. Can you provide some information in terms of how many folks have tested positive there? What's being done in terms of helping Canada Post deal with this outbreak and to support, protecting the safety of workers?
Sure. So the information that I have about that site, and again, I'll say that the outbreaks that happen are being dealt with by my colleagues, the local medical officers of health at the zone level, and so they would have the detailed information about that. But what happens in any outbreak, and it would be the same at the Canada Post location. I understand that there are 6 cases at that location. And so what happens in any kind of worksite outbreak is that the cases are identified and they're asked questions about when they started to have symptoms, and then the contact tracers determine what the time frame was where they could have passed that infection to others. And anyone who's a close contact of that person would be required to be home in self-isolation for 14 days from that point of last contact. And so that's all standard. All of that happens at any workplace. And in addition to that, the Alberta Health Services Medical Officers of Health do work with work sites when there are clusters or outbreaks that are identified to see if there's any specific work that needs to be done on the work site. In some cases, testing is offered to all employees at the work site, even those who are asymptomatic. I'm not sure whether or not that's been offered to Canada Post. And again, that happens at the discretion of the local medical officer of health based on the characteristics of the outbreak and the site and in discussion with the employer. So I don't have a lot more detail on that particular location, but we can talk to Alberta Health Services and see if there's any more specific interventions that have happened at that site.
Operator, could you put through our final question, please?
Final question is Adam McIver with Global News. Go ahead, Adam.
Hi, Dr. Hinshaw. I was just wondering about surgeries. Obviously, the first week when restarted here, what's being done to kind of address that? What can we expect when it comes to what's being done to address the backlog, whether that's overnight surgeries and things like that? Thank you.
Thank you. That's a great question for Dr. Jaffe.
Thank you for that question. Thank you, Dr. Hinshaw. So you were cutting out a little bit, but I understand the question is about surgical procedures that are being offered within Alberta Health Services. Let me first say that we know that this has been difficult on Albertans, and we are sorry for the inconvenience, the pain, the distress that is being suffered. We had to cut back on elective surgical procedures a number of weeks ago now. Of course, this was in order to enhance and prepare our capacity within the hospital and the intensive care unit setting so that we could provide care for Albertans who would require hospitalization. So we have maintained about 30 to 40% of our usual surgical volume, so emergency and urgent surgery and surgeries that were related to cancer and other diseases that simply could not wait certainly have gone ahead. So that's about 30 to 40% of our usual volume. Just this week, we have begun to open up day elective surgical procedures. As of today, we've conducted about 1,000 elective outpatient surgical procedures, again, as of this week. We are planning to slowly upscale the number that we are going to be doing over the next several weeks, so that within 6 weeks we'll be doing somewhere between 70 to 80% of our usual volume of elective outpatient surgery. Again, we know this has been hard on Albertans, and we are going to be trying to get at the wait list as quickly as we possibly can. There is a centralized triage system that's being used so that we can review individuals to see how long they've been waiting and to also get a sense for the urgency of the procedure. We're prioritizing based on urgency, based on how long the individual has been waiting. I know there was also a question about whether we'll be conducting overnight surgery. At the moment, we are not conducting inpatient surgery where individuals will be staying overnight, but we are looking at all possibilities at the moment. Certainly in the next several weeks, we will hopefully, as long as things go smoothly, we will be getting back to the usual procedures that require overnight or longer stays. We are going to be looking at whether we should be conducting surgical procedures overnight as just one option to try to deal with the backlog of surgery. Thank you.
Excellent. Thank you for joining us, everyone. We'll provide another update on Monday morning. Afternoon, my apologies. Have a great weekend.